Hey guys, welcome back to another absolutely terrifying historical deep dive that'll make you want to kiss your obstetrician, hug your pediatrician, and thank every medical professional who's ever worked in maternal and child healthcare. Tonight we're exploring one of history's most dangerous experiences, pregnancy and child rearing in medieval Europe, where becoming a mother was essentially playing Russian roulette with your life, and raising children meant watching most of them die before their 5th birthday, while everyone told you it was God's will. Before we embark on this journey through one of humanity's darkest periods for mothers and children, smash that like button if you're grateful for modern medicine, epidurals, and the fact that childbirth is no longer the leading cause of death for young women. Subscribe for more historical nightmares that'll make you appreciate contemporary life, and drop a comment letting me know, would you rather give birth in medieval Europe or never have children at all? Because after tonight's story you might seriously reconsider your answer. Now get comfortable, maybe grab some prenatal vitamins just to celebrate that they exist, and let's discover what pregnancy and motherhood were really like in an era where maternal mortality rates were so high that getting pregnant was considered a potential death sentence. Trust me, by the end of this tale, you'll never complain about morning sickness or diaper changes again. Morning sickness meets medieval medicine. Your first clue that something is terribly wrong comes when you wake up feeling like you've been poisoned, your stomach churning with nausea that makes you want to die, and you immediately run outside to vomit in the mud behind your medieval hovel that barely qualifies as shelter. The morning sickness hits you like a battering ram, except you have no idea what's causing it because sex education in medieval Europe consisted of lie back and think of England. The nausea is relentless, appearing every morning with the regularity of church bells, but significantly less welcome. You're throwing up everything you managed to eat, which is problematic because you barely had enough food to begin with. And now your body is rejecting even the moldy bread and watery soup that constitute your entire diet. The smell of cooking food makes you gag, the sight of meat makes you run for the nearest bucket, and you're starting to wonder if you've been cursed by a witch or if God is punishing you for some sin you can't remember committing. Your husband is no help whatsoever, suggesting helpfully that you're probably just weak or possessed by demons, because medieval men have exactly two explanations for any female health issue: moral failing or supernatural interference. The other women in your village eye you with a mixture of pity and knowing looks, but nobody explicitly tells you what's happening because discussing female biology is considered inappropriate and possibly sinful. But the morning sickness is just the beginning of symptoms that confirm your worst fears. The exhaustion is unlike anything you've experienced before, and considering you work from dawn until dusk every single day just to survive, that's saying something. You're falling asleep while spinning wool, nodding off during evening prayers, and struggling to complete basic tasks that were routine just weeks ago. Your body feels heavy, foreign, like it's been taken over by some force that's redirecting all your energy towards some mysterious internal project. Your breasts become tender and swollen, which is both painful and confusing because nobody warned you this would happen. Medieval clothing doesn't include supportive undergarments, so you're dealing with this discomfort while wearing rough linen that chafes against sensitive skin and provides absolutely zero support for your changing body. Every movement is uncomfortable. Every task requires navigating new physical limitations. The missed menstruation finally makes everything click into horrible clarity. You're pregnant in medieval Europe, where maternal mortality rates hover around 1 to 2% per birth, meaning every pregnancy is literally a gamble with your life, where 1 in 3 children die before their 5th birthday, where you have no prenatal care, no ultrasounds, no vitamins, no epidurals, and no modern medical knowledge to help you survive what's coming. And the diagnostic methods available to confirm your pregnancy are absolutely horrifying. How do you even know you're pregnant? Confirming pregnancy in medieval Europe involves a delightful array of pseudo-scientific tests that would make modern medical professionals weep into their diplomas while questioning how humanity survived this long. The most common method involves urine analysis, but not the simple pregnancy tests you can buy at modern pharmacies. No, medieval pregnancy testing is significantly more disturbing and completely useless. The popular needle test requires you to pee in a container, drop a needle into your urine, and leave it overnight. If the needle turns rusty or changes color, congratulations, you're pregnant. If it doesn't change, you might still be pregnant. Or you might not be, because this test has approximately the same accuracy rate as flipping a coin while blindfolded and hoping for the best. Another charming diagnostic method involves mixing your urine with wine and observing the reaction. If the mixture remains clear, you're supposedly not pregnant. If it becomes cloudy or forms strange patterns, you're expecting a baby. The scientific basis for this test is exactly as sound as it appears, which is to say non-existent, but medieval people are absolutely convinced it works, because they don't understand chemistry, biology, or basic scientific methodology. But wait, the diagnostic methods get even more bizarre and invasive. Some medieval physicians recommend the onion test, which involves inserting an onion or garlic clove into your vagina overnight and checking your breath the next morning. If you can smell the onion on your breath, you're not pregnant, because the passage between your vagina and mouth is supposedly open. If you can't smell it, congratulations, you're pregnant, because the passage is blocked by the baby. The logic here is so fundamentally flawed that it's actually impressive anyone believed this worked. Visual inspection by village-wise women involves examining your eyes for color changes, checking your skin for particular types of discoloration, feeling your pulse for mysterious pregnancy indicators that exist only in medieval imagination, and generally making educated guesses based on symptoms that might indicate pregnancy or might indicate any number of other conditions. The most reliable diagnostic method is simply waiting until your belly grows large enough to be obviously pregnant, which typically takes several months, and means you've spent that entire time uncertain about your condition while experiencing all the symptoms without confirmation. By the time everyone agrees you're definitely pregnant, you're already several months along, and starting to panic about the birth that's inevitably approaching. And once your pregnancy is confirmed, everyone has terrible advice that could literally kill you. Welcome to 9 months of medieval terror. The realization that you're pregnant in medieval Europe brings a unique combination of emotions. Brief joy at the prospect of motherhood, followed immediately by existential dread as you remember that pregnancy is one of the leading causes of death for women your age, and you're about to spend the next 9 months doing physically demanding labor while malnourished, without medical care, and hoping you don't die in childbirth like your sister did last year. Society's response to your pregnancy is equally disturbing. The church has many opinions about your condition, mostly involving how your pregnancy is simultaneously a blessed state and a punishment for Eve's original sin. This theological contradiction means you're supposed to be grateful for your pregnancy while accepting that the pain and danger are your fault somehow. Medieval pregnancy advice comes from everyone: helpful village women who've survived their own pregnancies through sheer luck, religious authorities who've never been pregnant but have strong opinions anyway, traveling physicians who learned medicine by reading ancient texts that are completely wrong about human anatomy, and random elderly people who remember various superstitions passed down through generations of equally ignorant ancestors. But the advice you receive ranges from merely useless to actively dangerous. You're told to avoid looking at ugly people or animals, because visual impressions supposedly affect your baby's appearance, meaning you spend 9 months avoiding eye contact with the village blacksmith who lost half his face in a forge accident and feeling guilty about it. You're warned not to raise your arms above your head, because it might strangle the baby with its umbilical cord, making simple tasks, like hanging laundry or reaching for items on high shelves, potentially fatal activities. Dietary restrictions are numerous and contradictory. Some people insist you should eat plenty of meat to make your baby strong, while others warn that meat consumption will make your child violent and aggressive. You're told to avoid sour foods that might give your baby a sour disposition, cold foods that might make your baby cold-natured, and spicy foods that might burn your baby from the inside. Following all this advice simultaneously is impossible, so you just eat whatever food you can access and hope for the best. The superstitions surrounding pregnancy are endless and exhausting. You must avoid sitting at corners of tables or your baby will be born with a crooked spine. You shouldn't attend funerals, or your baby will be marked by death. You need to wear specific amulets and charms to protect against evil spirits that supposedly target pregnant women. Breaking mirrors, spilling salt, or encountering black cats all require elaborate rituals to prevent supernatural harm to your unborn child. And the physical realities of medieval pregnancy make all the superstitious nonsense seem almost quaint by comparison. Humors, astrology, and baby gender predictions. Medieval medical theory operates on the principle that the human body contains 4 humors: blood, phlegm, yellow bile, and black bile. And pregnancy occurs when these humors achieve specific balances that create conditions suitable for generating new life. This theory is completely wrong about basically everything, that it's the foundation of all medical treatment you'll receive during your pregnancy, so you better get comfortable with people trying to balance your humors through methods that range from uncomfortable to potentially lethal. According to humor theory, pregnancy represents a hot and moist state dominated by blood and phlegm, which explains why pregnant women supposedly have different temperaments and physical characteristics than non-pregnant women. Medical treatments during pregnancy focus on maintaining proper humor balance through diet modifications, bleeding, purging, and various other interventions that medieval physicians believe are helpful but which modern medicine recognizes as dangerous quackery. Gender prediction methods are particularly elaborate and completely inaccurate, based on theories about how male and female fetuses supposedly develop differently based on humor balances, maternal behavior, and astrological influences. According to medieval wisdom, male babies develop on the right side of the womb, while female babies develop on the left side, reflecting society's general belief that males are fundamentally superior to females in all ways. But the gender prediction methods get progressively more ridiculous as medieval imagination runs wild. You can supposedly determine your baby's gender by which breast produces milk first, which direction you turn when you hear your name called, whether you carry high or low, and whether your pregnancy glow makes you more beautiful or less attractive. These methods have exactly zero scientific validity, but are treated as gospel truth by people who desperately want to predict something in a world where virtually everything about pregnancy and birth is terrifying and unpredictable. Astrological considerations add another layer of medieval pregnancy nonsense, with physicians and astrologers consulting star charts to determine optimal conception times, predict birth date, and forecast the child's future personality and health based on planetary alignments at conception and birth. The idea that distant celestial bodies influence fetal development is accepted without question by medieval society, making astronomy and astrology indistinguishable in practical medical application. Dream interpretation during pregnancy is considered particularly significant, with pregnant women's dreams supposedly providing prophetic information about their baby's futures, genders, and health prospects. You're encouraged to remember and report your dreams to various authority figures who will interpret them according to medieval dream symbolism that makes Freudian analysis look scientifically rigorous by comparison. And the Church's involvement in pregnancy management adds religious terror to medical ignorance. The Church's opinions on your pregnant body. The medieval Church has extensive and frequently contradictory opinions about pregnancy that range from treating it as a blessed miracle to viewing it as evidence of woman's sinful nature and divine punishment for Eve's transgression in the Garden of Eden. This theological confusion means you're simultaneously celebrated for fulfilling your biological destiny and blamed for the pain and danger that accompanies reproduction. Religious authorities insist that your suffering during pregnancy and childbirth is biblically mandated punishment for original sin, meaning any attempt to reduce pain or improve comfort is potentially sinful resistance to God's will. This interpretation of Genesis creates a culture where women are expected to endure pregnancy complications, difficult births, and postpartum suffering as spiritual obligations rather than medical emergencies requiring intervention. Sexual activity during pregnancy is complicated by church teachings that simultaneously recognize pregnancy as evidence of previous sexual activity while maintaining that sex is only morally acceptable when performed for procreation. Once you're already pregnant, sex serves no procreative purpose, making marital relations during pregnancy technically sinful according to strict theological interpretation. However, medieval marriage law also gives husbands conjugal rights that wives cannot refuse, creating an impossible situation where you're damned if you do, and damned if you don't. But religious control extends into every aspect of pregnancy management and behavior. Church-approved pregnancy behaviors include regular prayer for safe delivery, attendance at religious services despite physical discomfort, charitable acts that supposedly influence divine favor toward your unborn child, and wearing blessed objects that provide spiritual protection. Failure to observe proper religious protocols is believed to endanger both your life and your baby's eternal soul, making religious compliance a matter of life and death rather than personal choice. Confession during pregnancy becomes particularly important because dying in childbirth without proper religious preparation means potentially spending eternity in hell or purgatory. Pregnant women are encouraged to confess sins regularly throughout pregnancy and especially as the birth approaches, creating psychological pressure that adds spiritual anxiety to physical fear of childbirth mortality. Baptism urgency affects birth planning because unbaptized babies who die supposedly cannot enter heaven, instead residing in limbo for eternity. This theological crisis means that emergency baptism procedures must be ready at every birth in case the baby is born weak or dying, and midwives are specifically trained to perform emergency baptisms when priests aren't immediately available. And medieval superstitions add another layer of irrational fear to an already terrifying experience. Superstitions that could kill you or your baby. Medieval superstitions surrounding pregnancy create a complex web of behavioral restrictions, required ritual, and protective measures that are supposed to ensure safe delivery and healthy babies but which often add stress, restrict movement and sometimes create actual physical dangers through misguided protective measures. The superstitions reflect medieval society's desperate attempts to control unpredictable biological processes through supernatural means when actual medical knowledge is essentially non-existent. Protective amulets and charms are considered essential pregnancy accessories, with specific objects believed to ward off evil spirits, prevent miscarriage, ease labor pains, and protect against witchcraft. You're expected to wear consecrated jewelry, carry specific stones with supposed magical properties, and keep various religious relics nearby to create multiple layers of supernatural protection. The effectiveness of these objects is exactly zero, but failing to use them is considered dangerously reckless behavior that invites supernatural retribution. Food taboos during pregnancy are extensive and often contradict each other depending on which local tradition you're following. Rabbit meat supposedly causes cleft palates, fish causes scaly skin, strawberries create birthmarks, and beans cause various deformities. These restrictions are taken seriously enough that violating them can result in social censure and blame if your child is born with any abnormalities, regardless of actual causation. But some superstitions create actual physical dangers, rather than just psychological. Binding practices supposedly prevent miscarriage by physically constraining the pregnant belly, but they actually restrict fetal movement, impair maternal breathing, and create circulation problems that endanger both mother and baby. The tight binding is uncomfortable and dangerous, but refusing to follow this practice is considered foolish rejection of traditional wisdom that has supposedly kept babies safe for generations. Movement restrictions designed to prevent harm actually reduce physical fitness that would help during labor and delivery. You're warned against running, dancing, riding horses, lifting heavy objects, or engaging in vigorous activity that might shake loose the baby, leading to sedentary pregnancy that weakens muscles and reduces stamina needed for successful childbirth. The irony is that moderate physical activity would actually improve birth outcomes, but medieval superstition creates the opposite recommendation. Bloodletting during pregnancy is practiced to balance humors and prevent various complications, but removing blood from already anemic pregnant women creates additional health risks including weakness, dizziness, and increased infection vulnerability. The procedure is performed by barber surgeons using non-sterile instruments, adding infection risk to blood loss dangers in women who desperately need to maintain their strength for upcoming childbirth. And the dietary realities of medieval pregnancy make nutritional deficiencies almost inevitable. What can pregnant women actually eat? Medieval diet during pregnancy depends entirely on your social class, with wealthy noble women accessing varied foods including meat, fish, vegetables, fruits, dairy products, and refined grains, while peasant women survive on monotonous diets of coarse bread, pottage, vegetable soup, occasional cheese, and whatever seasonal foods are available. The nutritional quality gap between rich and poor is so extreme that wealthy women have significantly better pregnancy outcomes simply because they can afford adequate nutrition. Protein sources for peasant pregnant women are severely limited, with meat being an expensive luxury available only a few times per year during festivals or special occasions. Your primary proteins come from beans, peas, and occasional eggs when chickens are producing, but the quantities are insufficient for supporting both your body and growing fetus. The protein deficiency creates weakness, poor fetal development, and increased complications during pregnancy and birth. Vitamin and mineral deficiencies are universal among medieval pregnant women regardless of social class, because nobody understands nutritional requirements or how to prevent deficiency diseases. Iron deficiency causes anemia that leaves you constantly exhausted and weak. Calcium deficiency undermines bone health and tooth integrity. Medieval pregnancy often results in significant tooth loss, and vitamin D deficiency from limited sun exposure and dietary sources creates skeletal problems for both mother and baby. But food access is complicated by preservation limitations and seasonal availability. Food preservation methods in medieval Europe include salting, smoking, drying, and pickling, but these techniques reduce nutritional value while adding substances that aren't ideal for pregnant women. Salt-preserved meat contains extremely high sodium levels that contribute to water retention and blood pressure problems, while smoked foods contain compounds that modern medicine recognizes as potentially harmful to fetal development. Seasonal food scarcity means that late winter and early spring pregnancies are particularly dangerous, occurring during months when stored food supplies are depleted, fresh produce isn't available, and nutritional variety is minimal. Women pregnant during these starving months face malnutrition that increases miscarriage risk, stillbirth rates and maternal mortality while producing weaker babies who are less likely to survive infancy. Food safety is non-existent by modern standards, with no refrigeration, limited understanding of foodborne illness, and preparation methods that don't always kill dangerous pathogens. You're eating partially spoiled food regularly because throwing away marginal food isn't an option when calories are scarce. Accepting stomach upset and occasional food poisoning as normal parts of medieval life rather than preventable problems. And the complete lack of food safety standards creates constant poisoning risks. Food safe. Never heard of her. Food contamination in medieval Europe is so common that distinguishing between normal food and poisoned food is basically impossible without eating it and seeing whether you get sick. Grain storage allows various molds and fungi to grow, including ergot that causes hallucinations, gangrene, and death when consumed in sufficient quantities. Bread made from moldy grain is eaten regularly because refusing food isn't an option when starvation is the alternative. Meat safety is particularly problematic because slaughter and butchery occur without sanitation, refrigeration, or health inspections that might identify diseased animals. You're potentially eating meat from animals that died of illness rather than slaughter, meat that's been sitting in warm temperatures for days, and meat prepared with unwashed hands using contaminated cutting surfaces in conditions that would horrify modern health inspectors. Water contamination is universal in medieval cities and towns where wells, drinking water sources and waste disposal systems are not separated adequately. You're drinking water that contains human waste, animal waste, decomposing matter and various pathogens that cause diarrheal diseases, typhoid and other infections that are particularly dangerous during pregnancy when your immune system is already compromised. But cravings during medieval pregnancy create additional nutritional and social complications. Cravings versus reality. Spoiler: you're eating moldy bread. Pregnancy cravings in medieval Europe cannot be satisfied the way modern pregnant women can indulge specific food desires, because food availability is limited by season, social class, and economic resources that restrict access to anything beyond basic staples. Your cravings for fresh fruit during winter, meat when you're a peasant, or exotic spices that cost more than your annual income must be ignored because obtaining these foods is literally impossible. The medical interpretation of cravings in medieval theory suggests they indicate humor imbalances requiring correction through consuming specific foods, but the recommended treatments often don't match what you're actually craving. You might desperately want citrus fruit, which would help prevent scurvy, but medieval physicians recommend bloodletting to balance your humors instead, providing zero nutritional benefit while weakening your already compromised system. Social pressure surrounding pregnancy cravings reflects superstitious beliefs that unsatisfied cravings cause birthmarks, deformities, or temperamental problems in babies. If you crave strawberries and can't obtain them, your baby might be born with strawberry-shaped birthmarks as visible evidence of your failure to satisfy the craving. This belief creates guilt and anxiety around normal physiological responses to nutritional deficiency, and the desperation for adequate nutrition leads to dangerous dietary choices. Pico during pregnancy. Craving non-food substances is common in medieval Europe, particularly among women suffering from severe iron deficiency. You might find yourself eating chalk, clay, charcoal, or other minerals that provide some nutritional value but also contain toxic substances and create digestive problems. The practice is recognized as strange but not understood as a deficiency symptom that should be addressed through dietary improvement. Food-related superstitions create additional dietary restrictions that limit already inadequate nutrition. You're told certain food combinations are dangerous, specific foods cause moral corruption in unborn babies, and eating at particular times or in certain positions affects fetal development. These restrictions reduce your limited food options even further, creating nutritional deficiencies that endanger both you and your baby. Hunger is constant throughout pregnancy because food portions are inadequate for supporting both maternal and fetal needs simultaneously. You're perpetually undernourished, which medieval society views as normal rather than dangerous, not understanding that malnutrition increases every possible pregnancy complication while reducing your chances of surviving childbirth and producing a healthy baby who survives infancy. But nutritional challenges are complicated by clothing limitations that make physical discomfort constant throughout pregnancy. Hiding your pregnancy or not. Pregnancy visibility in medieval society depends partially on social class and personal circumstances, with some women attempting to conceal early pregnancy while others announce it immediately, depending on marital status, social position, and community expectations. Unmarried pregnancy requires concealment to avoid social punishment, while married women often celebrate pregnancy as fulfillment of wifely duties, though both groups face judgment regarding their pregnant bodies. Medieval clothing consists primarily of loose tunics and layered garments that naturally accommodate expanding waistlines without requiring specialized maternity wear, but the lack of structured support creates physical discomfort as pregnancy progresses, and your body changes in ways that medieval fashion does not anticipate or accommodate. The formless clothing is practical for hiding early pregnancy but provides zero support for breasts, belly, or back as your body transforms. Social attitudes toward pregnant bodies are contradictory and confusing, simultaneously treating pregnancy as woman's sacred purpose while viewing pregnant women's bodies as shameful and inappropriate for public display. You're expected to continue all normal activities while somehow remaining modest about your changing shape, creating impossible standards that make every public appearance fraught with anxiety about whether your pregnant form is offending community sensibilities. But medieval maternity fashion offers absolutely no practical support for your changing body. Medieval maternity wear. It's just bigger tunics. Medieval maternity clothing is essentially indistinguishable from regular clothing except for being slightly larger, consisting of the same basic tunics, shifts and overdresses that all women wear with perhaps an extra layer or looser construction to accommodate expanding bellies. The lack of specialized maternity design means you're making do with garments that provide no structural support and often become uncomfortable as pregnancy progresses, and your body requires different types of accommodation. Breast support is non-existent in medieval fashion, with women wearing simple linen shifts underneath wool or linen overdresses that offer zero support for breasts that become larger, heavier, and more sensitive during pregnancy. The lack of support creates constant discomfort and back pain that intensifies as pregnancy advances, but there's no medieval equivalent of supportive bras or maternity undergarments to address these problems. Belly support is similarly absent, with pregnant women carrying increasing weight without the benefit of belly bands, support garments or structured clothing that might help distribute the physical burden. The complete absence of support structures means your back, hips and legs bear the full weight of pregnancy without assistance, creating pain and exhaustion that make daily labor even more challenging, and your body is changing in ways that create constant discomfort and social awkwardness. Your body is changing and everyone has opinions. Physical changes during medieval pregnancy occur without the benefit of medical understanding, prenatal education, or supportive resources that might explain what's happening to your body and why. Your breasts grow larger and painful, your belly expands and feels heavy, your feet swell and don't fit in your shoes, and you have no idea whether these changes are normal or signs of dangerous complications requiring intervention. Back pain becomes constant as your belly grows and shifts your center of gravity forward, creating strain on muscles and joints that have no support from properly designed clothing or medical understanding of pregnancy biomechanics. You continue performing physical labor despite increasing pain because stopping work isn't an option when survival depends on continuous productivity, so you suffer through discomfort that modern pregnant women would address with rest, support garments and medical care. Social commentary about your changing body is constant and unwelcome, with community members feeling entitled to comment on your size, shape and appearance while offering unsolicited advice based on superstition rather than knowledge. People touch your belly without permission, make predictions about baby gender based on how you're carrying, and share stories about pregnancy complications that increase your anxiety without providing useful information. But the midwife who will help you through birth might actually offer some practical support. Meeting the woman who might save your life. The midwife in medieval Europe is typically an older woman who has experienced multiple births herself and learned midwifery through apprenticeship with more experienced practitioners, making her the most qualified medical professional you'll encounter during pregnancy. Despite having no formal medical education or understanding of anatomy, beyond what she's observed through practical experience, she represents your best hope for surviving childbirth, though her actual knowledge is limited, and her methods are based more on tradition than scientific understanding. Meeting your midwife for the first time creates a complex mixture of hope and terror, as you realize this woman will be responsible for your survival during the most dangerous experience of your life. But you have no way to evaluate her actual competence or success rates. She might be genuinely skilled through years of experience, or she might be perpetuating dangerous practices that kill women and babies while believing she's providing expert care. The midwife's social status in medieval communities is ambiguous and contradictory, with her services being essential and valued while simultaneously making her suspect as someone who deals with female bodies, sexuality, and reproduction in ways that religious authorities find potentially threatening. She occupies a position between respected healer and suspicious outsider, particularly if she's too successful at preventing deaths or helping with births that seem miraculous. But midwife training consists entirely of observation and experience without scientific education. Midwife training experience-based guessing. Midwifery training in medieval Europe occurs through informal apprenticeship rather than structured medical education, with aspiring midwives learning by observing experienced practitioners during birth, gradually taking on more responsibilities as they gain experience, and eventually practicing independently once they've assisted with sufficient deliveries to be considered competent by community standards. The quality of training depends entirely on the skill and knowledge of the mentor, creating massive variation in midwife capabilities. Medical knowledge available to midwives is severely limited, and often wrong, based on ancient texts that misunderstand anatomy, humor theory that provides incorrect explanations for physiological processes, and folk wisdom that confuses correlation with causation in ways that lead to ineffective or dangerous practices. Your midwife genuinely believes she's providing excellent care while doing things that modern medicine recognizes as harmful or useless. Skills that midwives do possess include patience during long labors, emotional support that helps women cope with pain and fear, practical experience recognizing normal versus abnormal labor progression, and physical manipulation techniques that sometimes help reposition babies for easier delivery. These legitimate skills make midwives genuinely valuable despite their medical ignorance, and women who birth without midwives have significantly worse outcomes on average. But midwives face constant suspicion of witchcraft that endangers them and disrupts community. When midwives are also suspected witches, witch trial threats loom over medieval midwives because their work involves mysterious female biology, intimate knowledge of women's bodies, and occasional unexplained deaths that suspicious communities might attribute to malevolent magic rather than natural complications or medical limitation. A midwife who loses too many patients might find herself accused of witchcraft, creating perverse incentives where self-preservation requires refusing to attend high-risk births that might end badly and damage her reputation. The association between midwifery and witchcraft stems partly from church suspicion of women who possess specialized knowledge and operate semi-independently from male authority, partly from genuine confusion about how midwives achieve positive outcomes in difficult situations, and partly from communities seeking scapegoats when pregnancy complications produce tragic results that someone must be blamed for. The persecution creates a climate of fear that discourages some women from becoming midwives while making others secretive about their method. Defensive practices adopted by midwives to avoid witchcraft accusations include religious displays that demonstrate piety, public prayers during births that invoke divine assistance rather than personal skill, and refusing to attend births where outcomes seem likely to be poor and might reflect badly on the midwife's reputation. These practices may protect midwives from persecution, but also limit their willingness to help women in desperate need of skilled assistance, and the approaching birth requires preparations that look suspiciously like funeral arrangement. Cavity. Making your will at 20 years old. Testament preparation during medieval pregnancy is standard practice, because maternal mortality rates are high enough that every birth carries significant death risk, making legal and financial arrangements necessary precautions rather than pessimistic overreactions. You're encouraged to write your will, make peace with enemies, confess sins, and generally behave as though death is imminent, which does absolutely nothing for your mental state as you approach childbirth with mounting terror. Financial arrangements include determining how your property, if any, will be distributed, who will care for existing children if you die, and what provisions should be made for your infant if you survive birth but die shortly afterward from infections or complications. These practical considerations are necessary but emotionally devastating, forcing you to confront your own mortality and plan for your children's futures without you. Spiritual preparation involves intense religious focus that includes regular confession to ensure you're in a state of grace if death comes during childbirth, receipt of last rites before labor begins in case you don't survive long enough to receive them afterward, and prayers that alternate between begging for survival and accepting divine will, if death is God's plan for you. The religious emphasis on acceptance and submission to divine will is supposed to provide comfort, but mostly increases anxiety. But everyone's morbid focus on your potential death creates psychological trauma that makes pregnancy even more terrifying. Why everyone treats you like you're already dead. Community treatment of pregnant women approaching birth includes behaviors that would be appropriate for people with terminal illnesses, with neighbors visiting to say goodbye, friends sharing final messages, and family members acting as though they're already grieving your loss before you've even gone into labor. This collective assumption that you might die creates self-fulfilling prophecy effects where stress and terror actually increase your risk of complication. Statistical reality supports community pessimism, with maternal mortality rates meaning that every woman knows multiple people who died in childbirth, and understands that pregnancy is genuinely one of the most dangerous things she'll ever experience. The historical data justifies the fear, even though the collective psychological impact probably makes outcomes worse by adding stress to already dangerous physical challenges. Farewell rituals before birth include emotional conversations where loved ones share final thoughts and memories, creating psychological burden of carrying everyone else's grief and fear while also managing your own terror about upcoming childbirth. You're supposed to comfort other people about your potential death while simultaneously facing your own mortality, which is an impossible emotional task that leaves you exhausted before labor even begins. And the religious preparations for potential death overshadow any preparations for successful survival. Last rites and labor rooms. Last rites administration before childbirth is routine practice in medieval Europe, with priests visiting pregnant women to perform sacraments that prepare souls for death and ensure divine forgiveness for sins that might otherwise condemn you to hell or purgatory. Receiving extreme unction before labor begins is considered prudent preparation rather than pessimistic assumption, acknowledging the very real possibility that you won't survive the next 20. Labor room preparation involves assembling the space where you'll give birth, typically your own bedroom or a designated birthing room that will be sealed off from male presence, and converted into an exclusively female space for the duration of labor and immediate recovery. The room is prepared with necessary supplies including clean linens if available, water for washing, religious items for spiritual protection, and tools that midwives might need during delivery. Female Support Network Assembly brings together experienced women who will assist during labor, providing emotional support, physical help, prayers and practical assistance throughout the birthing process. These women represent your primary support system, since male doctors rarely attend births and husbands are excluded from the birthing room entirely, making female solidarity your only resource during the most dangerous experience of your life. But once labor actually begins, all the preparation in the world can't prevent the absolute nightmare that awaits you. No pain relief, no epidurals, just screaming. Labor pain in medieval Europe must be endured without the benefit of effective pain relief, anesthesia or modern medical interventions that make childbirth survivable and less traumatic for contemporary women. The pain is described in religious texts as punishment for Eve's sin, and therefore something women must suffer as divine mandate, making any attempt to reduce pain potentially sinful resistance to God's will and woman's proper penance for original sin. The onset of labor contractions begins gradually, with mild cramping that progressively intensifies into waves of pain that overwhelm your ability to think, speak, or function normally. You're encouraged to remain calm and prayerful, but the pain makes prayer impossible as your mind focuses entirely on surviving each contraction and dreading the next one that you know is coming. Medieval understanding of labor mechanics is essentially non-existent beyond observing that contractions push babies out eventually if you don't die first. Your midwife and support women have no way to measure cervical dilation, predict labor duration, or identify complications until they become obvious through visible signs like excessive bleeding or baby positioning problems that can be felt externally. But the pain is just the beginning of the physical nightmare that is medieval childbirth. The duration of labor is unpredictable and can last for days rather than hours, with no medical interventions available to speed the process or provide relief during extended labors that exhaust your strength and increase risks of infection, hemorrhage, and other complications. You labor in the same position for hours or days because medieval birth positions are limited, and changing positions frequently isn't standard practice yet. Physical exhaustion accumulates as labor continues without adequate rest, nutrition, or hydration. You're too nauseated to eat, too uncomfortable to sleep between contractions, and too focused on pain management to think about maintaining your strength for the pushing phase that will require enormous physical effort after you're already depleted from hours of contraction. Dehydration becomes serious concern during extended labors because you're sweating, possibly vomiting, and not drinking enough water to replace lost fluids. The dehydration creates additional complications including decreased blood volume that makes hemorrhage more dangerous, reduced ability to generate effective contractions, and general weakness that impairs your ability to push effectively during final delivery stages. And medieval pain management consists of basically nothing useful at all. Medieval pain management, prayer and leather straps. Pain management techniques in medieval childbirth consist primarily of religious comfort through prayer, recitation of psalms, wearing religious relics that supposedly ease suffering through divine intervention, and essentially hoping that God takes mercy on you while you scream through contractions that feel like your body is being torn apart from inside. The religious approach provides psychological comfort for some women, but does absolutely nothing to address physical pain. Leather straps or ropes suspended from ceiling beams allow laboring women to hang and pull during contractions, using gravity and physical effort to manage pain and potentially help labor progression. This technique has some practical value because upright positions can aid delivery, but it also exhausts already weakened women who must support their body weight while experiencing intense pain. Herbal remedies with questionable effectiveness include various teas, tinctures, and poultices that medieval midwives believe help with labor pain, but which have minimal actual analgesic properties. Some herbs like willow bark, containing salicin, precursor to aspirin, provide mild pain relief, while others are either useless or potentially dangerous to mother and baby. But when complications arise, medieval medicine has almost nothing to offer except prayers and hope. Complications that would be simple today. Labor complications in medieval births often prove fatal because medical knowledge and interventions are so limited that conditions easily managed in modern hospitals become death sentences in medieval birthing rooms. Breech presentations, baby positioned feet or bottom first instead of head down, frequently result in stillbirths or maternal death because medieval midwives lack the skills and knowledge to safely deliver breech babies or perform emergency intervention. Shoulder dystocia, babies' shoulders becoming stuck during delivery, creates emergency situations where babies die from oxygen deprivation during prolonged delivery attempts, or mothers suffer severe tearing and hemorrhaging from aggressive manipulation trying to extract stuck baby. Medieval midwives use various physical maneuvers to address shoulder dystocia, but success rates are poor and injuries are common. Placental complications including placenta previa, placenta blocking birth canal, and placental abruption, premature placental detachment, cause hemorrhaging that medieval medicine cannot control. Without ability to perform emergency caesarean sections, blood transfusions or surgical interventions, these complications almost always result in maternal death and often stillbirth as well. And finally, if you survive labor, you face the actual delivery, which brings its own unique horror. Delivery methods that sound like torture. Delivery positions in medieval Europe typically involve women kneeling, squatting, or sitting on birthing stools rather than lying flat on their backs, which is modern standard position. The upright positions actually have some advantages because gravity assists delivery, but the physical demands of maintaining these positions during exhausting labor are enormous for women who are already depleted. Birthing stools are specialized furniture designed for childbirth, featuring horseshoe-shaped seats with open fronts that allow babies to emerge while providing some support for laboring women. The midwife kneels in front of the birthing stool to catch the baby, guide its emergence, and monitor for complications. The stools are practical but uncomfortable, and extended time on birthing stools creates additional pain from pressure and awkward positioning. Physical assistance from midwives includes manual manipulation of the baby's position during delivery, applying pressure to the abdomen to encourage contractions, and sometimes inserting hands into the birth canal to reposition babies or assist with stuck delivery. These interventions are performed without anesthesia, pain relief, or sterile technique, making them both excruciating and dangerous. But the delivery techniques can cause serious injuries that create lifelong complications. Tearing during delivery is common and often severe because medieval midwives don't perform controlled episiotomies, and tears are allowed to happen naturally as babies emerge. The tears frequently extend into the rectum or cause severe damage that doesn't heal properly, creating permanent incontinence, pain, and difficulty with future births. Stitching techniques are primitive. Infection is common, and healing is slow and often incomplete. Forceps haven't been invented yet in most of medieval Europe, so stuck babies must be delivered through manual manipulation, aggressive pulling, or simply waiting and hoping the baby eventually emerges. The lack of instruments that could safely assist difficult deliveries means that many babies die during prolonged delivery attempts, and mothers suffer severe injuries from the extended trauma. Emergency procedures for impossible deliveries include literally breaking the baby apart inside the mother to extract it piece by piece if it's clearly dead and cannot be delivered intact. This horrifying procedure, called embryotomy, is performed with hooks and knives while the mother is conscious, creating trauma that often proves fatal from shock, blood loss, or infection, even if the mother physically survives the procedure itself. And the birth process is observed by an audience that makes your most vulnerable moment a public spectacle. Everyone's watching your most vulnerable moment. Birth attendants in medieval Europe typically number between 5 and 20 women, creating a crowded birthing room where your labor and delivery happen with an audience of community women who provide support, but also witness every moment of your most vulnerable, painful, and intimate experience. Privacy is essentially non-existent, because birthing is considered a communal female experience, rather than private medical event. Social hierarchy even invades the birthing room, with upper-class births attended by more women, including ladies of similar social standing who provide moral support, while lower-ranking servants handle practical tasks. The presence of social equals means you must maintain some level of composure and dignity, even while experiencing the worst pain of your life and possibly dying. Male exclusion from birthing rooms is absolute, with husbands, fathers, and male physicians barred from entering the exclusively female space of childbirth. This gender segregation has both advantages and disadvantages, but when things go catastrophically wrong, medieval medicine has almost nothing to offer except prayer and grief. What happens when things go wrong? Obstetric emergencies in medieval births often result in maternal death, infant death, or both, because medical interventions are so limited that serious complications cannot be addressed effectively. When labor fails to progress after days of contractions, when hemorrhaging begins and cannot be controlled, when babies are clearly stuck and cannot be delivered, the birthing room becomes a death watch where everyone prays for miracles while expecting tragedy. Hemorrhaging is particularly deadly because medieval medicine cannot perform blood transfusions, has no effective drugs to stop bleeding, and lacks surgical techniques that might address internal bleeding sources. Midwives try to control bleeding through abdominal compression, herbal remedies and prayer, but severe hemorrhaging typically proves fatal within hours, while everyone watches helplessly. Infection during or immediately after birth is common due to non-sterile conditions, unwashed hands, and general lack of understanding about disease transmission. Puerperal fever, childbed fever, caused by bacterial infection, kills enormous numbers of women in the days and weeks following delivery, starting with fever and pain that rapidly progress to delirium, organ failure, and death despite frantic attempts to cool fevers and pray for recovery. And if your baby emerges alive, you face the terrifying uncertainty of whether it will survive its first hours and days. Stillbirths and infant deaths immediately after birth are common enough that attendants are prepared with emergency baptism supplies, tiny shrouds, and realistic expectations that babies who appear weak or malformed probably won't survive. The grief of stillbirth is profound but also expected in a world where infant mortality is so high that parents learn to protect their hearts by not becoming too attached to newborns until they've survived several weeks or months. Resuscitation attempts for babies born not breathing include techniques like blowing into their mouths, slapping them, immersing them in water of different temperatures, and various other methods that occasionally work if babies are viable but need stimulation. The desperation to save any baby that might be alive drives creative interventions that sometimes succeed through luck rather than knowledge. Birth defects and abnormalities visible at birth create immediate questions about whether the baby should receive care and resources, or be allowed to die through benign neglect. Medieval societies have limited ability to care for children with serious disabilities, and religious interpretations sometimes view malformations as signs of divine displeasure or demonic influence, creating moral dilemmas about how to respond to imperfect baby. But even if you and your baby both survive the birth itself, the postpartum period brings new dangers that kill many women who survive delivery. Churching, getting purified after birth. Churching ceremonies in medieval Europe are religious purification rituals that new mothers must undergo approximately 40 days after giving birth, based on biblical traditions that treat postpartum women as ritually unclean and requiring cleansing before they can resume normal social and religious activities. The ceremony involves prayers of thanksgiving for survival and purification rites that symbolically cleanse the pollution of childbirth from your body and soul. The 40-day waiting period keeps new mothers confined to their homes and excluded from church attendance, social gatherings, and public activities while they recover physically and wait for religious purification. This confinement has practical health benefits because it enforces rest period. but it's religiously motivated by concepts of feminine impurity rather than medical understanding of postpartum recovery needs. Social implications of churching include making women's return to public life contingent on religious ritual rather than physical readiness, reinforcing church control over women's bodies and lives while perpetuating ideas that pregnancy and childbirth are polluting experiences requiring spiritual cleansing. The ritual is both celebratory, you survive, and shameful, you're unclean and need purification, creating complex emotional experience that doesn't fully honor your survival of extremely dangerous experience. But while you're waiting for religious purification, your body is going through brutal physical recovery without medical support. Postpartum depression in a world that doesn't believe in it. Postpartum emotional changes, including what modern medicine recognizes as postpartum depression and postpartum psychosis, are experienced by medieval women, but interpreted as moral failures, spiritual attacks, demonic possession, or punishment for sins rather than medical conditions requiring treatment. You're expected to be joyful and grateful for surviving childbirth and producing a baby, so any sadness, anxiety, or emotional difficulties are seen as personal failings rather than hormonal and neurological responses to massive physiological changes. Symptoms of postpartum depression, including persistent sadness, difficulty bonding with baby, intrusive thoughts, loss of appetite, and sleep disturbances beyond normal newborn care demands, are dismissed as laziness, ingratitude, or evidence of moral corruption. The lack of recognition that these symptoms represent medical conditions means you suffer without support or treatment while being judged for emotional responses that are actually quite common and have biochemical causes. Postpartum psychosis in severe cases can produce hallucinations, delusions, and dangerous behaviors that medieval societies interpret as demonic possession requiring exorcism rather than psychiatric intervention. Women experiencing postpartum psychosis are sometimes restrained, subjected to religious rituals that traumatize rather than heal, or in worst cases accused of witchcraft if their symptoms include behaviors that seem supernatural to observers who don't understand mental illness. And the physical recovery process is brutal without modern medical care or pain management. Recovering without modern medicine, physical trauma from childbirth, including vaginal tearing, abdominal muscle separation, pelvic floor damage, and potential internal injuries, must heal without pain medication, antibiotics, or surgical repair that might be necessary for serious injury. You recover through rest when possible, though childcare and household duties continue regardless of your physical condition. Herbal remedies with limited effectiveness, and time that allows some healing while permanent damage often remain. Infection risks during postpartum recovery are extremely high because of non-sterile birth conditions, continued lack of hygiene understanding, and general vulnerability of damaged tissue to bacterial invasion. Puerperal fever remains a serious threat during the weeks following delivery, with mortality rates staying high even after successful births as infections develop and spread through reproductive system into bloodstream. Hemorrhaging can continue or restart during postpartum period if blood clots dislodge or if tissue damage doesn't heal properly. Medieval treatments for postpartum bleeding are largely ineffective, consisting mainly of bed rest, herbal astringents, and prayer. Severe hemorrhaging during postpartum period is often fatal because blood loss weakens women who are already depleted from childbirth. But even as you're recovering from the trauma of birth, you must immediately begin the exhausting work of keeping your baby alive. Infant care without science. Newborn care in medieval Europe is based entirely on tradition, superstition, and observation, rather than scientific understanding of infant needs and development. You receive advice from experienced mothers and midwives, but much of this advice is either useless or actively harmful, according to modern pediatric standards. The challenge is distinguishing between helpful traditional practices and dangerous misconceptions without any medical knowledge to guide your decisions. Initial newborn assessment by midwives includes checking for visible defects, observing breathing and color, and making judgments about baby's viability and strength based on cry quality, muscle tone, and general appearance. Babies deemed too weak or unlikely to survive might receive minimal care based on practical resource allocation in communities where infant mortality is so high that investing heavily in fragile babies seems wasteful. First feeding attempts determine whether baby can nurse effectively, which affects survival prospects dramatically because alternatives to breastfeeding are limited and dangerous. Babies who can't nurse properly face starvation unless you can afford wet nurses or manage to hand feed using dangerous methods that often introduce contaminated milk or inadequate nutrition. But infant care practices include many traditions that are actively harmful to babies' health and survival. Swaddling, bathing, and medieval baby care. Swaddling practices in medieval Europe involve wrapping babies tightly in cloth bands that restrict all movement, supposedly to prevent limb deformities and encourage straight growth. The tight swaddling is maintained almost constantly, with babies bound like little mummies for weeks or months. While moderate swaddling can be comforting, medieval swaddling is often so tight it restricts circulation and breathing while preventing normal muscle development. Bathing newborns is controversial in medieval practice, with some traditions advocating for immediate washing while others warn that bathing removes protective birth coating and makes babies vulnerable to illness. The bathing debate is complicated by water quality issues, because available water is often contaminated with pathogens that can infect newborns' sensitive skin or be accidentally ingested during baths. Salt rubbing is common newborn treatment where babies are rubbed with salt supposedly to toughen their skin and improve their health. This practice is not only painful for babies, but also potentially harmful because it causes skin irritation, dehydration, and possible infection if baby's skin is damaged during overly aggressive rubbing. The practice persists because people believe it works based on babies who survive despite the treatment rather than because of it. And the mortality statistics for infants make every day a desperate fight for your baby's survival. Why most babies don't see their first birthday. Infant mortality rates in medieval Europe range from 30–50%, meaning between 1/3 and 1/2 of all babies die before reaching their first birthday. The causes include infection, malnutrition, accidents, congenital conditions, and simple failure to thrive in conditions that don't adequately support infant health and development. The statistics are so grim that parents learn to emotionally protect themselves by not becoming too attached to babies until they've survived past the most dangerous early months. Common causes of infant death include diarrheal diseases from contaminated feeding substance, respiratory infections that babies cannot fight off with immature immune systems, malnutrition from inadequate breast milk or dangerous feeding alternatives, and sudden infant death from causes that medieval medicine cannot identify or prevent. Preventable deaths occur constantly because of lack of medical knowledge, dangerous childcare practices, inadequate nutrition, and general environmental hazards that threaten babies who are completely dependent on adults for protection and care. Many infant deaths could be prevented with modern medical knowledge, but you don't have access to that knowledge and must instead follow traditional practices that sometimes kill babies while believing you're providing proper care. And feeding your baby presents its own set of potentially fatal challenges. The breast milk debate. It's complicated. Breastfeeding in medieval Europe is the expected and preferred method of infant feeding, with mother's milk considered ideal nutrition that also conveys moral and temperamental characteristics from mother to child through the milk itself. However, successful breastfeeding depends on adequate maternal nutrition, proper technique, sufficient milk production, and baby's ability to nurse effectively, all of which can be compromised by poverty, malnutrition, physical complications, or infant health problems. Religious and moral dimensions of breastfeeding make it not just a practical feeding method, but a spiritual duty that good mothers fulfill personally rather than outsourcing to wet nurses. Church teachings emphasize that mothers should nurse their own children as part of their maternal obligations, though wealthy women often ignore this guidance and hire wet nurses anyway, because extended breastfeeding delays return of fertility and potential for producing additional heir. The belief that breast milk conveys maternal characteristics creates anxiety about wet nursing because using another woman's milk supposedly transfers her qualities to your baby. Careful selection of wet nurses based on their moral character, physical health, and temperament reflects concerns that their milk might corrupt your child's developing personality and health. But successful breastfeeding is far from guaranteed in medieval conditions. Wet nurses, luxury or necessity. Wet nurse employment represents both luxury choice for wealthy families who can afford to outsource infant feeding and desperate necessity for mothers who cannot produce adequate milk due to malnutrition, illness, or other complications. The wet nurse market creates complex social dynamics where poor women with surplus milk sell their nursing services to wealthier families, while sometimes neglecting or weaning their own biological children to accommodate their nursing employment. Selection criteria for wet nurses include assessing their physical physical health, moral character, milk quantity and quality, and whether they have recently given birth themselves, fresh milk is considered superior. The evaluation process can be humiliating for women seeking wet nurse positions who must prove their milk production, demonstrate their health, and accept intrusive questions about their sexual behavior and moral standing. Wet nurse living arrangements vary by family wealth and preference, with some wet nurses living in employer households as servants, while others nurse babies in their own homes, while continuing their regular lives. The arrangements affect how much contact mothers have with nursing infants, and create attachment complications when babies bond with wet nurses who provide most of their care and feeding. But what happens when breastfeeding fails and wet nurses aren't available or affordable? What happens when you can't produce milk? Lactation failure or insufficient milk production creates desperate situations because alternatives to breast milk are limited, dangerous, and often fatal for babies who depend on them for survival. The causes of lactation problems include maternal malnutrition, illness, exhaustion, and simple biological variation that means some women cannot produce adequate milk regardless of circumstance. Hand-feeding alternatives using animal milk, usually goat or cow milk, diluted with water and fed through cloth nipples, small spoons, or feeding horns, create numerous health risks, including contamination with pathogens, nutritional inadequacy that doesn't meet infant needs, and physical difficulties with feeding methods that often cause choking or aspiration. Many babies die from hand-feeding complications that modern formula feeding methods have solved. Pap and panada, bread soaked in water or milk, are sometimes used as infant foods when milk is unavailable, but these foods are nutritionally inadequate for babies who need the fats, proteins, and other nutrients present in breast milk. Babies fed primarily on bread-based foods suffer from malnutrition, failure to thrive, and vulnerability to infections that healthy breastfed babies might resist. And once your baby survives infancy, the toddler years bring entirely new categories of danger. Child safety? What's that? Toddler safety in medieval Europe is essentially non-existent by modern standards, with homes, streets, and general environment filled with hazards that kill or injure small children who are developmentally programmed to explore without understanding danger. Open fires in hearths, wells without covers, stairs without railings, tools and weapons left accessible, and general lack of childproofing create constant threats that parents must manage through vigilance rather than environmental modification. Drowning risks from wells, rivers, drainage ditches, and even large water containers kill many toddlers who wander away from supervision or fall into water while playing. Medieval communities don't install safety barriers around water hazards because the concept of environmental modification for child safety doesn't exist yet, so drowning prevention relies entirely on adult supervision that isn't always adequate or possible given other demands on parents' time and attention. Fire hazards from open hearths, candles, oil lamps, and cooking fires create constant burn risks for curious toddlers who are attracted to flames without understanding the danger. Serious burns often prove fatal due to infection, shock, or inability to properly treat extensive injuries with medieval medical knowledge and resources. But the environment isn't even the biggest threat to toddlers' survival, keeping tiny humans alive in deadly conditions. Disease exposure for toddlers is constant and often fatal because their developing immune systems cannot fight off the numerous pathogens present in medieval environments where hygiene is poor, water is contaminated, food safety is non-existent, and crowded living conditions facilitate disease transmission. Diarrheal diseases, respiratory infections, and childhood illnesses like measles kill enormous numbers of toddlers who might survive these illnesses with modern medical care. Malnutrition affects most medieval children, including toddlers who have survived infancy, because food supplies are inadequate and dietary variety is limited by season, social class, and economic resource. The malnutrition impairs growth and development while increasing vulnerability to diseases that healthy children might resist, creating vicious cycle where poor nutrition and frequent illness reinforce each other. Accident rates for toddlers are high because of dangerous environments, inadequate supervision, parents are working constantly and cannot watch children every moment, and general acceptance of injury and death as normal parts of childhood that cannot be entirely prevented. Children fall from heights, get trampled by animals, ingest poisonous substances, and experience countless other accidents that modern child-proofing and supervision practices help prevent. And medieval society expects children to start working and contributing economically at ages that would horrify modern people. When do kids start working? Answer: too young. Child labor begins as soon as children are physically capable of performing useful tasks, typically around ages 4-5, when toddlers can help with simple chores like fetching water, watching younger siblings, feeding animals, and assisting with basic household or agricultural tasks. The early introduction to labor is both economic necessity, families need all available labor to survive, and cultural norm. Childhood is not recognized as a distinct life stage requiring protection from adult responsibility. Age-appropriate tasks are assigned based on children's developing capabilities, starting with simple jobs that even small children can manage and progressively increasing responsibility and difficulty as children grow stronger and more skilled. By age 7 to 8, children are doing substantial work that contributes meaningfully to family economy and household functioning. Gender-specific training begins early, with boys learning trades, agricultural skills, or crafts from their fathers, while girls learn domestic skills, textile production, and household management from their mother. The gender-differentiated training prepares children for their expected adult roles while limiting opportunities for those who might prefer or excel at tasks assigned to the opposite gender. But working children still need some form of education, though what constitutes education varies wildly by social class and gender. Boys versus girls. Wildly different futures. Educational opportunities in medieval Europe are dramatically different for boys and girls, with boys from wealthy families receiving formal education in reading, writing, Latin, mathematics, and classical knowledge, while girls are typically excluded from academic education and trained instead in domestic skills, needlework, and household management, that prepare them for marriage and motherhood. Class distinctions in education are even more dramatic than gender differences, with aristocratic boys receiving extensive education from private tutors or in cathedral schools, while peasant boys receive no formal education beyond practical training in agricultural or craft skills through apprenticeships or family instruction. The educational divide reinforces social hierarchies by ensuring that literacy and advanced knowledge remain concentrated in upper classes. Religious education represents one area where both genders and multiple social classes receive some instruction, with basic religious knowledge taught through church attendance, oral instruction, and memorization of prayers and catechism that don't require literacy but ensure everyone understands fundamental Christian doctrines and behavioral expectations. But formal education isn't the only path to medieval success. There are other options that are equally challenging: apprenticeships, convents, and child marriage. Apprenticeship systems for boys, starting around age 7 to 12, involve living with master craftsmen who teach specific trades while providing food and shelter in exchange for labor that begins as simple assistance and gradually progresses to skilled work as apprentices develop competence. The apprenticeships last for years, typically 7 years, and essentially transfer parental authority to masters who have rights to discipline, direct, and train apprentices however they see fit. Convent placement for girls represents alternative to marriage for families who cannot provide adequate dowries or who have daughters who are unmarried by late teens and early 20s. The convents require entrance fees that are typically less than marriage dowries, providing economical option for disposing of surplus daughters, while also offering girls themselves potential escape from unwanted marriages and dangerous childbearing. Child marriage arrangements begin early in medieval Europe, with betrothals sometimes arranged when children are still infants and marriages commonly occurring at puberty or shortly after for girls, ages 12 to 15. The early marriages reflect economic and political considerations rather than romantic love or emotional readiness, treating marriage as business arrangement between families rather than personal relationship between individuals. But regardless of educational path or life trajectory, medieval childhood is defined primarily by work and struggle rather than play and development. Most kids don't get to be kids. Childhood as distinct life stage protected from adult responsibilities and dedicated to play, learning and development is not recognized in medieval Europe, where children are viewed as small adults who should contribute economically as soon as physically possible. The modern concept of childhood as special period requiring protection and nurturing simply doesn't exist, making medieval childhoods harsh by contemporary standards. Play is limited and often consists of activities that also build practical skills rather than pure recreation. Children's games include mock battles that train fighting skills, running and climbing that develop physical fitness, and role-playing games that rehearse adult activities they'll perform as workers and parents. Toys are simple and often homemade, with wealthy children having some manufactured toys while poor children play with found objects and improvised playthings. Protection from adult realities including violence, sexual content, death, and harsh economic conditions, is essentially non-existent because children witness and experience all aspects of medieval life from early ages. They see animals being slaughtered, attend public executions, learn about sex through observation of adults and animals, and understand death intimately because they experience the deaths of siblings, relatives and community members regularly. And the constant presence of disease and death means medieval parents must cope with grief that modern parents can barely imagine. Why you'll probably lose multiple children. Child mortality statistics in medieval Europe are horrifying by modern standards, with approximately 30–50% of children dying before age 5. And overall childhood mortality meaning that families who start with 6 to 8 children might expect only 2 to 4 to survive to adulthood. The staggering death rates mean that losing children is normal experience for medieval parents who must cope with repeated grief while continuing to care for surviving children and maintain family functionality. Common causes of child death include infectious diseases like measles, smallpox, and whooping cough that modern vaccines prevent, diarrheal diseases from contaminated water and food that cause fatal dehydration, respiratory illnesses that progress to pneumonia without antibiotic treatment, and injuries or accidents that would be survivable with modern trauma care, but prove fatal in medieval conditions. Emotional impact of child loss on medieval parents is profound, despite cultural adaptations that encourage some emotional distance as protection against inevitable grief. You love your children desperately but also try to guard your heart, knowing that statistically many won't survive, creating psychological tension between attachment and self-protection that makes parenting emotionally complex and often painful. But medieval medicine offers almost nothing useful for sick children, making every illness potentially fatal. Medieval medicine for sick kids. Spoiler: it doesn't work. Pediatric medicine in medieval Europe is based on same flawed humor theory and superstitious practices that govern adult care, but with even less effectiveness because children's smaller bodies are more vulnerable to harmful treatments and less able to survive medical interventions that are dangerous even for adults. Sick children receive bloodletting, purging, herbal remedies with questionable effects, and prayers that provide emotional comfort but no medical benefit. Diagnostic limitations mean that different illnesses with similar symptoms receive identical treatments that might be wrong for all of them, while distinct diseases requiring different approaches are treated interchangeably because medieval physicians cannot distinguish between various conditions. A child with measles might receive the same treatment as one with scarlet fever or typhoid, with success depending more on luck and natural disease progression than medical intervention effectiveness. Treatment efficacy for childhood illnesses is so poor that survival often depends more on child's natural immune response and disease severity than on any medical care received. Some children survive despite treatments that are actively harmful, while others die despite everything medieval medicine attempts to do to save them. Parents try everything available, knowing that most of it probably won't work, but desperate to do something rather than simply watch children die without intervention. And the grief of losing children must be managed without modern psychological support or acknowledgement of trauma. Grief without modern support systems. Bereavement practices in medieval Europe provide some structure for processing grief through religious rituals, community support and cultural expectations about mourning periods, but they don't address the psychological trauma of losing multiple children over years of parenting. You're expected to accept child deaths as God's will, to trust that deceased children are in heaven if properly baptized, and to continue functioning as parent, worker and community member despite devastating losses. Religious comfort includes beliefs that deceased children become angels in heaven, that suffering is temporary while eternal life is forever, and that earthly attachments should be subordinate to spiritual concern. These beliefs provide some consolation for grieving parents but can also create guilt for experiencing normal grief that seemingly questions divine wisdom or suggests insufficient faith. Community support for bereaved parents exists, but is limited by the fact that everyone is experiencing similar losses regularly, creating shared grief that normalizes child death, while also making it difficult to fully process individual loss. Your neighbors understand your pain because they've experienced it too, but this universality also means that extraordinary grief support isn't provided because child death is too common to treat each loss as exceptional tragedy. But even in the darkness of constant loss, medieval parents develop strategies for survival and for finding meaning in brutal circumstances. What actually keeps children alive? Practical survival strategies for medieval children center on basic hygiene practices. Even without understanding germ theory, adequate nutrition when possible, despite resource constraints, protection from obvious environmental hazards, and vigilant supervision during the most vulnerable early years, when children are most at risk from accidents, illness, and other threats that can be partially mitigated through parental attention. Hygiene practices that actually help include regular bathing when water is available and weather permits, keeping children's clothing and bedding as clean as possible, given medieval washing limitations, and isolating sick children from healthy siblings to reduce disease transmission, even without understanding exactly how diseases spread. Nutritional strategies within medieval constraints involve prioritizing children's feeding when food is scarce, breastfeeding as long as possible to provide immunity benefits and adequate nutrition during infancy, and ensuring children receive protein from whatever sources are available, including eggs, cheese, and occasional meat. Well-fed children survive illnesses better than malnourished ones, making nutrition the single most important factor parents can partially control. But survival also requires accepting harsh realities that are beyond parental control. Environmental modifications that are possible within medieval technology include covering wells to prevent drowning, keeping sharp tools and weapons stored away from young children, maintaining careful watch over hearth fires, and teaching children from very young ages about specific dangers they need to avoid. These common-sense precautions prevent some accidents even though medieval homes remain inherently dangerous by modern standards. Community cooperation helps survival by sharing childcare responsibility, pooling resources during hardships, providing mutual support during illnesses or injuries, and transmitting knowledge about successful childcare practices from experienced parents to new mothers who are learning through trial and error. The extended family networks and tight community bonds in medieval villages create support systems that help families survive challenges that would overwhelm isolated parents. Medical care from midwives and healers who have practical experience even without formal training can occasionally make the difference between child survival and death, particularly for injuries, minor illnesses, or situations where traditional remedies based on accumulated experience happen to be effective. While medieval medicine is severely limited, it's still better than no medical attention at all for children who become sick or injured, and successful medieval parents develop philosophical approaches that help them cope with circumstances beyond their control. The strategies medieval parents used, emotional regulation strategies for medieval parents facing constant threats to children's health and survival, include developing some degree of emotional distance as psychological protection against inevitable loss, while still maintaining enough attachment to motivate proper childcare and create family bonds that make life meaningful, despite hardship. Faith provides genuine comfort for many medieval parents who believe their children's souls are safe in heaven, even when physical bodies are lost, that suffering serves divine purposes beyond human understanding, and that earthly life is temporary preparation for eternal existence. These religious beliefs help some parents cope with devastating losses that would be even more unbearable without spiritual framework providing meaning. Practical focus on controllable factors helps parents maintain sanity by directing energy toward things they can influence rather than dwelling on larger systemic problems they cannot solve. You cannot eliminate disease, prevent all accidents, or guarantee adequate nutrition in medieval economy, but you can love your children, do your best with available resources, and take satisfaction in small daily successes that add up to keeping children alive another day. But even effective coping strategies cannot completely shield parents from the brutal emotional reality of losing children. Making peace with horrifying realities. Acceptance of mortality as normal part of life rather than preventable tragedy helps medieval parents function in circumstances that would paralyze modern parents with anxiety and grief. The statistical reality that many children won't survive creates cultural adaptations including delayed naming ceremonies, lower investment in infants until they've survived past the most dangerous early months, and philosophical frameworks that emphasize eternal life over earthly existence. Meaning making through religious and cultural narratives helps parents understand their suffering as part of larger divine plan rather than random cruelty, finding purpose in their struggles and believing that their parenting efforts matter even when outcomes are tragic. The narratives don't eliminate pain but provide frameworks for processing grief and continuing to function despite repeated loss. Community solidarity in shared suffering creates bonds among medieval parents who understand each other's experiences because they're living through similar challenges. The universality of child loss means that every parent is both survivor and potential support for others, creating networks of mutual understanding that help everyone cope with realities that no one can escape but must somehow endure. And just when you've found some way to make peace with the brutal realities of medieval parenthood, you hear a familiar voice calling from very far away. The sound is unmistakable, someone calling your name in a language that isn't medieval English or Latin, speaking words that don't belong in the 1300s, using a tone of voice that comes from your original time and place. For a moment you're confused and disoriented, caught between two worlds and two identities, uncertain which reality is real, and which is the nightmare that's ending as consciousness shifts. The voice grows stronger, more insistent, more demanding of attention, pulling you away from the medieval world where you've learned to survive against impossible odds, where you've experienced joys and sorrows beyond modern comprehension, and where you've discovered depths of resilience you never knew you possessed. You realize with mixture of relief and profound sadness that this has all been a vision, a dream, or some kind of temporal displacement that's coming to an end. Medieval Europe is fading around you like morning mist. The children you've known and lost are becoming memories, and you're being drawn back to your own time, your own world, your own life with its vaccinations and antibiotics and blessed epidurals that make childbirth survivable. But something fundamental has changed in you. During your time as a medieval mother, you've experienced motherhood in civilization where maternal mortality was so high that pregnancy was essentially playing Russian roulette with your life, where losing multiple children was expected rather than exceptional, and where parenting meant doing your best with almost no resources, no medical knowledge, and no support systems that modern parents take for granted. You've learned that humans can endure almost unimaginable suffering while still finding meaning, love, and purpose in their lives, that maternal love persists, even in circumstances that seem designed to break the human spirit, and that resilience isn't the absence of pain but the determination to continue despite it. You've discovered that modern medicine is literally miraculous compared to medieval healthcare, that contemporary child safety standards save countless lives that would have been lost in earlier eras, and that the ability to keep children alive and healthy is perhaps humanity's greatest achievement, even though modern parents often don't recognize how extraordinary it is. And as medieval Europe disappears completely, you're left with memories and insights that will change how you understand parenthood, suffering, and the value of modern medical care. Hey, are you still there? Did you survive that absolutely harrowing journey through medieval pregnancy and child rearing? Or are you currently hugging your pediatrician and sobbing with gratitude for modern medicine, prenatal vitamins, and the fact that childbirth is no longer the leading cause of death for women in their 20s? If you made it through that medieval nightmare without developing serious appreciation for epidurals, antibiotics, and the miracle of contemporary maternal health care, then you might be tougher than actual medieval mothers who somehow survived these conditions through sheer willpower and ridiculous amounts of luck. That was genuinely one of the darkest periods in human history for mothers and children, and we just spent however long exploring every horrifying detail. I know, that was brutal. Your brain probably feels like it went through medieval medical treatment, got purged of humours, had some leeches applied, and emerged somehow more confused than when it started. But if you're still conscious and haven't fled to thank every medical professional you've ever encountered, then you definitely have the mental fortitude to survive historical deep dives into humanity's darkest eras. But here's the thing that makes this medieval nightmare even more impactful. After experiencing pregnancy and child rearing in medieval Europe, where maternal mortality was 1% per birth, where 1 in 3 children died before age 5, and where motherhood meant accepting that you'd probably lose several children and might die yourself during childbirth, modern pregnancy complaints are going to seem incredibly manageable. Morning sickness, swollen feet, and uncomfortable third trimester sleep issues are still real problems. But they're not writing your will at age 20 because you might die in childbirth. Modern parenting challenges, including sleepless nights with newborns, toddler tantrums, and navigating childhood illnesses, are genuinely difficult and exhausting, but they're happening in context where vaccines prevent diseases that used to kill half of all children, where antibiotics cure infections that were once death sentences, and where pediatricians can actually help rather than just guessing based on medieval humor theory. Think about it. When you're stressed about finding the right childcare, researching the best car seats, or debating parenting philosophies with other modern parents, remember that medieval parents were primarily concerned with whether their children would survive to see their 5th birthday. The fact that modern parents get to worry about developmental milestones, educational opportunities, and emotional well-being rather than basic survival represents almost unimaginable progress, and the medical advances that make modern motherhood survivable deserve way more recognition than they get. Epidurals for pain management during childbirth represent the difference between excruciating suffering that women endured for thousands of years and manageable discomfort that allows you to actually experience childbirth without being traumatized by agony. The fact that pain relief during labor was considered sinful for most of human history while modern women can choose their pain management strategies is revolutionary progress that should never be taken for granted. Caesarean sections that are now routine procedures performed with anesthesia and antibiotics used to be death sentences that were only attempted when mothers were already dying and the goal was trying to save baby. The fact that modern C-sections save countless lives of both mothers and babies every single day represents medical advancement that cannot be overstated in its importance. Prenatal care, including ultrasounds, genetic testing, monitoring for complications, and early intervention for problems used to be completely impossible, meaning that pregnancies that modern medicine easily manages were fatal in medieval time. Every pregnancy complication that gets detected and treated today represents a life saved that would have been lost in earlier eras. So drop a comment and let me know, after tonight's medieval horror show, which historical nightmare should we explore next? Would you rather experience Victorian-era surgery before anesthesia was invented, survive the Black Death plague in 1340s Europe, live through childbirth in ancient Egypt where medical care was somehow even worse, or maybe something completely different like experiencing mental health care in medieval asylums or dental care before modern dentistry? Your choice will determine our next journey into historical suffering that makes contemporary life seem absolutely miraculous. Maybe we could explore what healthcare was like for any medical condition in pre-modern eras, or investigate other aspects of medieval life that were equally horrifying, including food safety, work conditions, or general lack of human rights for basically everyone except aristocratic men. The possibilities for historical educational content, are essentially endless. And seriously, don't forget to engage with this content because modern medicine deserves celebration. Smash that like button if you're grateful for modern obstetrics, pediatrics and the thousands of medical professionals who've made it possible for childbirth to go from one of the most dangerous things women do to one of the safest medical procedures in human history. That transformation represents countless hours of research, innovation and dedication from medical professionals who deserve recognition for saving millions of lives. Subscribe for more historical nightmares that'll make you appreciate contemporary life more than you ever thought possible, because understanding how brutal life used to be really does create gratitude for modern conveniences, medical care and human rights that previous generations couldn't imagine. Plus, these historical deep dives are excellent conversation starters when you want to make people uncomfortable at dinner parties by casually mentioning medieval obstetric practices. Hit that notification bell because you never know when you might accidentally time travel again and need advanced preparation for surviving whatever historical period decides to kidnap you next. Trust me, after experiencing medieval motherhood where pregnancy was life-threatening, child death was expected, and medical care consisted of prayer and luck, you'll want to be mentally prepared for whatever historical nightmare we explore next. And finally, share this video with people who need perspective on modern parenting challenges. Send this to any parents in your life who are struggling with contemporary parenting difficulties and need reminding that while modern parenthood is legitimately challenging, it's also incredibly privileged compared to medieval child-rearing where the primary goal was just keeping children alive through infancy and early childhood. Modern parents get to focus on optimal development, educational opportunities, and emotional well-being rather than basic survival. Share it with pregnant friends who are nervous about childbirth and need reassurance that modern obstetrics is literally miraculous compared to medieval birthing practices where maternal mortality was so high that getting pregnant was genuinely life-threatening. Contemporary childbirth is safer than it's ever been in human history, which doesn't eliminate all risks but does put them in historical perspective that makes modern outcomes seem almost unbelievably positive. Forward it to anyone who complains about modern medicine being imperfect. Yes, contemporary healthcare has problems, but those problems exist in context where we can actually treat diseases, prevent deaths, and provide care that was completely impossible throughout most of human history. Perfect is impossible, but modern medicine is pretty damn amazing compared to medieval alternatives of prayer, bloodletting, and hoping for the best. Sweet dreams, time traveler, and maybe schedule some appointments with your OBGYN, pediatrician, and dentist, just to thank them for existing in an era where their education and skills can actually save lives rather than operating based on medieval humor theory and superstitious nonsense. Remember, every time you feel overwhelmed overwhelmed by modern parenting challenges, just think back to tonight's medieval nightmare, and remind yourself that at least you don't have to write your will at age 20, plan your funeral before giving birth, or accept that you'll probably lose several children before they reach adulthood. Modern problems really are first world problems when compared to medieval survival challenges that tested the absolute limits of human endurance and resilience. Until next time, stay safe, stay healthy, hug your children a little tighter while appreciating that they're vaccinated and receiving pediatric care. And remember that every day you experience modern medicine is a day worth celebrating, because people throughout most of human history would have considered our medical capabilities to be literal miracles. And one more thing, if this video made you appreciate modern health, consider donating to organizations that work to improve maternal and child health worldwide, because there are still places where pregnancy and childbirth carry risks, similar to medieval Europe, and modern medicine could save countless lives if resources and access were available. Historical nightmares teach us to appreciate what we have while remembering that not everyone has access to the same medical miracles, and we can help change that.